Hey guys, Dr. G here. Today I'm going to be taking you through Mckenzie extension exercises. We're going to be showing you these exercises. They're great for really acute bouts of low back pain. Now, typically I highly recommend people do get a full evaluation from either a medical practitioner or a Mckenzie-based doctor before performing these exercises. But what I want to show you is something that may help some of you in a really acute situation or a borderline emergency situation where, say you're, over the weekend you have a really sharp pain in your low back and you can't manage it, ibuprofen doesn't seem to help you and you aren't able to go get a medical opinion. This is a great place to start, and a couple of really basic moves that might actually help relieve your symptoms. It can also help with patients that have pain traveling into their lower extremity, whether it be a radiculopathy or referred pain pattern. So we'll take you through these really quickly. If you're in a lot of pain, the way to start is going to be in a standing position. There's a couple ways to do these exercises, including on your stomach, but standing will be the least invasive or the easiest way to do it if you are in a very limited position. So we'll get Ali to stand up over here and I'll show you how these work. So the first thing that you're going to do is you're going to put your hands at the base of your spine and you're just going to try and drive your hips forward, try and get your hips to go over your toes. You go to the point of pain and then you come back. We typically do 10 repetitions when we're doing this. So just the way that she's doing it, you go to the point of pain, come all the way back. Don't force yourself through that barrier. Let the repetitions actually improve the range of motion instead of trying to just push past that range of motion. This may be difficult for somebody who's in a lot of pain. You may have an inch of movement, but after a couple sets, you might get 3-4 inches and the pain might start to subside, and that's what we're really looking for. Okay. The next one is if you're feeling a little less intense in terms of pain, or maybe you've been doing these a little bit and your range of motion's improved, you can go ahead and lay on your stomach. The first way that I start this one is actually not with repetitive motions, but just having somebody hang out in that extended position. So if you've ever done yoga, think about a cobra position. So Ali will go up on her forearms for me and just hold that position for 10, 15, 20, 30 seconds, depending on what you can tolerate. Some people might hang out here all day and have a lot of relief from it. Others, they'll be there for 30 seconds, then maybe they'll lay back down, relax for another 10, 20, 30 seconds, depending on what their comfort level is, and then they'll come back up. If you find yourself comfortable in this position, then you can start to do the same idea, which is the repetitive end range loading. So in the office here, if we're doing this exercise, I may actually stabilize the spine here, but if you're doing it at home, you don't need to get somebody to stabilize that for you. That's okay. We'll make that decision in office. Instead, we'll just go ahead and go on your hands like you're going to do a push-up. You're going to focus on keeping the front of your hips on the table, and she's going to lift up, keeping those hips up, and then back down. And she'll go all the way up until the point of either a pain barrier or a mechanical barrier. Some of you with a really intense pain may actually feel like you're hitting a physical barrier you can't get by, and that's okay. Keep doing sets of 10. Increased repetition may actually get you past that physical pain barrier. As she's doing this, one thing to think about is if you're a patient who has pain that's going down the legs, sciatica-like pain or radicular pain, we're looking to see if that pain traces back up the leg. In a lot of cases, you'll find that, say it started in the foot, after a set of 10, you might see it in the knee. After a set, 2 or 3 sets of 10, you might feel it only in the butt or into the low back. And that's a really positive sign. And I encourage you to do more repetitions if you're experiencing that sort of relief. Now, the one caveat is if you're doing these exercises, and let's say you had pain into the thigh that felt sciatic-like, if the pain starts to go down into your foot or it starts to go farther away from where it once was, that's a red light. We're going to ask you to stop these exercises. This is not the exercise for you. So that's going to be really important that you pay attention to while you're doing these. And that'll really be the only reason that I ask you to stop trying these. Again, it is important to get a proper evaluation to determine if these exercises are right for you and your condition. However, if you're in a bind and you're in a lot of pain, this is a great place to start in terms of self-management and a tool that you can use at home.